Hi.
It just keeps getting complicated, huh?
Well, I just don't understand what's happening. I mean,
He said he couldn't get to it. So it's in the back, so he can't get to it with the laparoscopic thing. That's the message he sent me.
right.
And it's too far in the back for the radiologist to get to it, and so we're kind of stuck. So the second question for you is, I know you follow with the Liver Institute.
Yes.
Have they done a liver biopsy on you?
They have.
Okay. Recently, or was it in the past? And tell me what they told you it
It
showed.
was about a year and a half ago.
And did it show anything?
It showed, at that time he said I had a certain stage of cirrhosis.
Cirrhosis. Okay.
Right? And then as I follow up with him every so
yeah.
often,
Yeah.
at one point they said, Dr. Lowitz,
Yeah.
that's the person I saw, and
Yeah.
he says, well, it looks like it's getting better.
Okay.
And I'm like, okay, so he had a model of the liver.
Yeah.
Where am I right now? Because the last time I was with you, you said stage 3 or stage 4. And so he says, well, now you're not as bad. Not as bad.
Okay, so it's recovering. Yeah.
Right. So I said, okay, so I don't drink.
Yeah.
I take my medications. He just recently put me back on Versodial.
Yeah.
I was afraid to take it after I got sick 2 years ago, which is where they found the lymph node. And so they put me on a lower dosage to make sure I could take it.
Tolerated, yeah.
So far, so good. I'm not throwing up, no diarrhea, no nothing. So.
Okay. I mean, I don't have any other suggestions. I can't actually do any of the procedures myself. All I can do is knock on doors to see if somebody can. But Dr. Santia, and if, he's an excellent surgeon. So if he says he can't get to it, then I'm not even going to ask the question to anybody else.
Right.
Because
he actually said, which kind of relieved me, but I don't know if it's false relief. He said, it looks like the lymph node has gotten smaller. And I'm like, okay, so I started looking at some of my previous reports, and I saw it on one report from like May of 2023 to May of 2024, and I showed it had gone down a little bit, but then on the last report it doesn't say anything about it.
So the issue is we can all obsess about the size. At this point the question has come back to, is there anything we can do about it? Right now, nothing, because you've been turned down by 2 surgeons now and 1 radiologist. So there's no option to get a diagnosis.
Okay.
So we will certainly have some sort of schedule to see whether this is going to be 6 centimeters in 2 years or 5 years or whatever. But the only other thing to discuss with Dr. Lowitz when you go back to see them is whether he thinks a repeat liver biopsy might be helpful. Because the liver is also still enlarged. And if it's a blood issue, maybe like a low-grade lymphoma or something, sometimes it can involve all the organs. And so nothing that I feel like it may be just a backdoor into a diagnosis, and maybe I'm overreaching. But other than waiting and scanning at a reasonable frequency so we're not exposing you to so much radiation that we become the problem, there's not that much else that I can offer at this point.
Okay. So he did mention, wrong glasses. He said the way he mentioned it to us, my brother and I, he said, it's small right now, and if I was to go in, it would require a major surgery.
Right.
And then to go in and find out that it's, what's that word, malignant or benign. He goes, that's a lot of procedures to put you through.
Correct.
To find out it's benign, but then on the other side I was like, okay, but what if it's malignant?
Well, if it's malignant, it's sure taking its time to declare itself, That's the thing. If it was malignant, if it's a malignancy that we can treat, then it shouldn't be hovering between the same 1 centimeter size, 1 centimeter up, 1 centimeter down. And so I think everybody's done the due diligence they can. And at this point, we have to weigh the risk and benefit to you. And I would just say monitor, but next time you go to Dr. Lowitz, you can ask him about repeating a liver biopsy. Because that's not super invasive. It is still invasive, but it's not like going from the outside and puncturing things. They do the endojugular.
So by doing the liver biopsy again, what's that supposed to?
I don't know if it's supposed to, but if there is indeed all I can think of that would be a low grade thing that hasn't grown. The only cancer that fits that profile would be a low grade lymphoma, which can fluctuate in the same lymph node size for decades. And that's why low grade lymphoma doesn't even require treatment the moment you diagnose it. We only treat it if the lymph node actually goes about 7 centimeters. Like there's actual guidelines on when to treat it. So the only cancer per se that this kind of lymph node fluctuation can fit the profile for is a low grade lymphoma. And sometimes, not all the times, sometimes biopsying the liver, which is also part of the blood system, the spleen is also part of the blood system, biopsying the liver, which is also enlarged, your liver is still enlarged on the imaging, looking at that organ again, and if we pick up some lymphoma there, then we can assume that what's happening in the liver is also happening in the lymph nodes. Again, it's a stretch, but I've been stretching to try to get a diagnosis on you since the day we met.
Yeah.
So it's a question to ask to see if they think that the value is there for doing that test again.
So, okay, and I'm just thinking ahead, not knowing anything about this. At some point, let's say it is low-grade lymphoma.
Yeah.
And maybe it starts growing a little, which I am not wishing for, and I'm praying I don't have that happen. At that point, what would be the treatment?
Oh, that's not a discussion worth having right now. Well, you don't have it. If you have it, and if we actually prove it, then you have to first meet the criteria for treatment.
Okay.
And then when you meet the criteria for treatment, if you have a low-grade lymphoma, who knows what the treatment landscape is going to be? We have like 20 new drugs approved every year.
Oh, okay.
So any discussion from 2025 is going to be obsolete in 2030 or whenever, and when you need it. So
well, I'm glad you said that because I don't even know.
That's not a discussion worth having.
Okay.
So I would do a CT in 6 months.
CT, okay. 6 months.
And then if that's also within the 2 centimeter range, 2.5, then we'll go 12 months after that.
Then 12, okay. I write it down because my brother asked me.
And
I never know, I might not remember tomorrow.
It's a good idea.
Okay, so for now, we just keep monitoring.
Yeah.
And I will talk, I'm supposed to see Dr. Lowitz in about 2 months.
Yeah, I think that's fair. Just when you go, say, hey, nobody can get to that lymph node, so we're watching. But in the meantime, she was just wondering if biopsying the liver again would be helpful.
Okay.
And he'll weigh in.
Okay.
That's all we can do.
And so if he does that, then I would also have him send the results to you.
Of course,
right?
yeah.
Okay.
So.
I just don't ever know if
they don't, then we get it. No worries. If the procedure is done and we know it's done in the continental U.S., we'll get it.
Okay.
Yeah.
I always worry because I always try to make sure you have everything.
No, but if I know something is done, then we can get it. That's not a problem. Now we go to Mexico, we don't know what to do there.
No, we're not going to Mexico.
If you're in the continental U.S., you are our patient, and you sign a release that it's okay for us to get your records. So as long as we know what you did where, we can get it from anywhere.
Okay, good to know.
All right, see you in 6 months.
All right.
We'll get you set up for the lab, CT, and a televisit in 6 months.
Okay.
All right.
Okay, sounds good. Thank you.
Bye.